We have before us today more than 2,000 pages of legislative text that will give us public policy that costs more than $1 trillion and creates a huge morass of government bureaucracies. Over 100 new offices, bureaus, commissions, and programs. Let's look briefly at just one of these new offices. The Democrats empower a new super bureaucrat with unprecedented authority over personal health care decisions, the Health Choices Commissioner, heading up the Orwellian Health Choices Administration. In the short time that we've had since this legislation was made public, we've combed these pages in the first part of these 2,000 pages to see if we could get a picture of the responsibilities, authorities, and powers that were granted to this individual. As you can see, Madam Speaker, we actually had to go back to the supply store to get enough of these tabs. This super bureaucrat, this Health Choices Commissioner, it turns out will have powers to define, deny, deem, determine, assess, administer, and establish our health care benefits for all Americans. It is no wonder that millions of Americans are afraid of a government takeover of our health care. How can they not fear such a thing? This is unprecedented. This amount of power granted to one bureaucrat. And of course, there are other bureaucrats in this bill. I don't believe that this bill should see the light of day. It certainly should not pass. It's a recipe for job losses. It's a clear power grab by Washington bureaucrats. It's a power grab. We ought to discard it altogether. Press the reset button. Start over. We can do better. The American people deserve better. Let's vote no on this power grab by Washington bureaucrats. I reserve the balance of